Hi, so my name is Gavinash Prasad. I'm the Regional Health Officer, Region number 4. So today we're doing a walkthrough with the Minister, PS, and other important persons at the Diamond Diagnostic Centre, which is currently being converted to a smart center, meaning that we are smart in the sense that we will be energy efficient and we have a building that's structurally sound that can withstand the forces of nature. The prime objective of doing the walk around today is to look at the progress of the work, because we would have a patient load here of about 500 per day, and we want to ensure that everything is in place so that the public can be well served, and also highlight areas that needs a little bit of tweaking in order for efficient service delivery. So within that we have looked at the new patient waiting area that would cater for safe social distancing as it relates to COVID-19.
Can you share with us from today's visit?
The purpose of the visit from the Permanent Secretary's office is to come with the Minister and the RHO, with my team, engineers, and the project coordinators to identify areas of adjustments or improvement. We focus mainly on the financial side and resource mobilization and coordinating with the regions, PAHO with the SMART project, and the Ministry of Health to make sure that we synchronize the funding necessary to complete the essential expansion and projects that are required. One of the other objectives is to make sure we stay on time. So working with the Minister's guidance, we want to make sure we're executing and staying on the timelines, and then holding each one of the partners accountable to achieve those timelines. So this walkthrough this is my first visit to really understand what needs to be done and when, and then work with the team to enhance or compact the project timeline to get more resource and run projects concurrently so that we can get the job done faster, because we know we're operating within a small timeline, and we also want to be ready to have COVID infrastructure ready, as part of the national plan for COVID and healthcare providing. So that's pretty much the gist of my part, and we're optimistic that it will be completed on time.
So the project is within budget, and the timeline it's moving in part, Mr.
At this stage it is within, and whatever adjustment we need to make, we intend to make it to adjust to that. So yeah.
Thank you.
Thank you.
Yeah, from the last time we were here to now, I think a lot of progress has been made. We have seen the project come together. It has now better flow. We now know how things are going to be arranged in such a way as to improve the efficiency of the hospital, and we are very pleased with what we've seen so far. Smart hospitals, the terminology that we are using, is also a methodology to make hospitals more climate resilient, and to make them more efficient by using alternative energy. And this facility will be using solar panels to ensure that part of the electricity is covered with solar energy. And I'm very pleased to see that these solar panels have been installed, the battery bank and everything else has been in place. So the majority of the rooms in this facility would be done by solar, and we'll only go to GPL power if it's absolutely necessary. In addition to that, the system is so designed that we'll be collecting rainwater, which would reduce the amount of water that would be used by the facility. And that's another way of how we're making these facilities more sustainable. So in the long run, it's going to save the ministry monies that we would have otherwise have to spend on electricity and water, because we're using these sustainable technologies. In addition to that, the renovations that we have done would prevent us from having things like flooding and so forth, because we have now improved the facility to prevent such things. So, as I said, I'm very pleased with where we are today. We are hoping that the building itself can be handed over to the ministry so that we can continue operations for patients who need these services on the East Bank by sometime in December. But works would still continue on the exterior, in the yard of the building, so that we can complete those types of works. We have identified a few things that we would want to add to the existing scope of works, but those things we will probably have to see where we can access financing to do those extra bits of work. But generally we are extremely pleased by what we've seen here today.
All right, for my information, could you give us just briefly the funding for the facility and where it came from and so on?
These facilities, this is a concept that has been in Europe and more particularly in the UK, of making health and other facilities more climate resilient. And so the UK government has given us funding through DFID, and with these funding we will be doing this facility here at Diamond. We will be doing the Lenora Cottage Hospital, Mabaruma Hospital, Letham Hospital, and Paramakatoi Hospital. So the funding is already secured. This project is, I would say, nearing completion, and the others, we are now starting those other projects. And again, as we start up the projects, we talk to the community, we try to decant the service to nearby facilities so that service provision is not compromised. So we'll find out ways and means of providing service while we, we do the repairs and the retrofitting of the institutions that I mentioned.
All right. And lastly, again, for information purpose, what would be the capacity?
This facility generally serves about 500 persons per day, I understand. But you have different departments here. So you have the outpatient department, you have an emergency department, they do surgery here, and we have surgical wards, we have a maternal and child health section. So we do offer a variety of services here, and again, 500 people is a lot of people, and that is why we have to make some additional provision, because the waiting area for this facility, when it was built and conceived, it never intended to have social distancing. So our waiting area, if we do social distancing, we would have limited capacity in the building itself, and therefore we are now making some additional provision for waiting space outside of the facility. So that's one of the additions that I spoke about, and we'll have to see in which area we can access some financing to add that specific facility into what is already being done here.
Okay, thank you, sir.